My name's Curtis Rigney. I'm a chiropractor. I'm very pleased to be here today. Open Day is a very exciting day for everyone. For me, I get to see all this, see and feel the vibe of all the potential energy, everyone on the verge of the next step of their life. It's a very exciting time, so I like to be a part of that. So I appreciate the opportunity that I'm given to be here. I'm here to talk to you about chiropractic and the study of it. I've been in the business of chiropractic education for over 20 years now. I just only recently figured that one out. And I've had the good fortune of experiencing chiropractic education around the world by teaching in different schools in Japan and US, Canada, and England. And this experience gives me a global perspective of chiropractic education, which I'm grateful for. I've been here at Macquarie for 10 years, and that anniversary just recently passed. So that's very exciting for me. This presentation is very much, it's designed very similarly as I would a lecture. So if you were to come into our program, I'd be one of the first people you meet. And so here's a little preview of what you might experience. And along those lines, I usually have a discussion slide. Can I help you?
I was just trying to.
Oh, okay. Thanks. I like to give you an overview of what the lecture is about. We're going to talk about what chiropractic is to some extent, and some brief history, and share some results about a research project that recently completed about attitudes about chiropractic. And also, I'd like to talk to you about, we'll discuss the degree process at Macquarie, and some options you have after you graduate with the appropriate degrees for chiropractic. So that's what we're talking about today. The term chiropractic comes from a Greek interpretation of done by hand. That wasn't actually created by a chiropractor. It was created by a patient, an early patient of chiropractic, and he's the one who came up with this name, chiropractic. So to me, that actually holds a lot of importance because I really value the work that I do with my hands. It is a primary care healthcare profession. That means people can come off the street or come directly to us, and because of our ability to diagnose and treat, we don't require any referrals from another healthcare provider. The profession is defined by the World Federation of Chiropractic, which is an organization seated within the World Health Organization. Is a diagnosis, treatment, and prevention of neuromusculoskeletal disorders and the effect of these disorders on general health. So that's a pretty broad perspective. The thing that's unique to it is the focus on the neuromusculoskeletal. So that's the thing that helps define what chiropractic is. We have an emphasis on the neuromusculoskeletal system. So done by hand. There's an emphasis on manual procedures. It's not the only thing we do, but most of what we do, and I'm in the area in the instructions in the courses that I teach, that is the hands-on sort of aspect of the care. And so there's an emphasis, it's not all that we do. And another emphasis is on joints. We pay a lot of attention to the joints. And it's not just the joints of the spine, like everyone thinks. That's the majority of the reason why people come to us, are spinal problems. But we do actually learn a lot about the extremities, your arms and legs and the joints and therein. And we also then look at the soft tissues like the muscles and fascia, and we even discuss skin as a potential area of that needing to be looked at and treated. And another aspect of chiropractic is the fact that we rely on natural processes. We don't use drugs, and we don't prescribe drugs, and we also don't do surgery. We essentially traditionally do not break the skin. So we do other things other than those modalities. And a big part of what we do is education, patient education and advice. We also engage in exercise therapy, ways to empower the patient to manage their own conditions. Diet and nutrition is a big part of helping patients have a healthier, happier life, and which is what we try to promote. So I see often my perspective of chiropractic is more of a health coach and not necessarily the therapist. But we do apply manual therapies and we do that sort of thing. But a big part of what we do is help people live happier, healthier lives. And so it's a whole person approach. We take very strong considerations of what they call the biopsychosocial aspect of the patient. We take very detailed histories. We learn a lot about what the patient is going through, what might be contributing to their experience. So we care very much about the whole person. And another aspect of our care is outcome measures. We like to work towards outcomes. These outcome measures can be questionnaires and visual analog scales and whatnot, but another outcome that is very important to us is the goals of the patient. What is the patient looking for? And so we work toward those goals as well. So to be a good chiropractor, if you're thinking about becoming a chiropractor, I think these sort of characteristics are important. That it is helpful that you enjoy the company of people because it's a very people-oriented profession. So you have to enjoy people and being around them. It's helpful if you want to help people and you want to care for them and you want to help them achieve their health goals. Another exciting thing from my perspective is the problem-solving aspect. You gather all kinds of clues when you're in practice. You take histories, you observe posture and gait and movement, and you do these assessment tools. You move different body parts. Then you try to put these clues together to see what is wrong with a patient. It's like being your own CSI person. You have your own collection of tools. You have to go and look for them, and you put it together, and then you eventually make a decision, and then you decide on how you're going to help that person, if you are the right person to help them. And so that keeps your mind active. It keeps your work more interesting because every patient has a different story. No two patients are the same. So that makes for an interesting career. The other thing that's helpful is you like working with your hands. So it is a good profession in that there's a lot of mind work and a lot of hand work. So you're not sitting down at a desk all day. You get to do the experience with working with your mind, and you get up and use your body to do your work every day. So a bit about the history. D.D. Palmer was the first one to adjust a patient. He was originally a magnetic healer. This was a common form of healthcare during that part of the time. And he adjusted a patient, and that was the birth of chiropractic. Since then, and right away, there was a development of chiropractic, but there's quite a few individuals who follow the same principles as the fountainhead, the founder of the profession. But the majority of chiropractors have gone beyond those early principles of D.D. Palmer. And so there's been the time of development, that there was growth within the profession, and in the 1970s was a huge time of growth where research was becoming more a part of it, so the evidence-based chiropractic was developing, early research within the profession. And we get to the 1990s, and in 1990, two significant events happened, which really helped the profession grow. And that is, one, I wonder if that's the physics lab, or it could be the chemistry lab. So two things was, in the United States, some chiropractors felt that that the medical association was conspiring against chiropractic. So all these years, since the beginning, there's been some struggles that the profession has experienced, and each struggle that the profession experienced, it has only caused the profession to grow. So these struggles are actually a good thing in that it makes it a stronger profession. And but it was nice that in 1990 there was some recognition that the AMA, the Medical Association, was found to be conspiring against chiropractic, and that is against the the Sherman antitrust laws. So the AMA had to apologize for the behavior and change their ethics laws, and that was a huge thing because in the United States then it was no longer a problem for medical doctors to refer patients to chiropractors. And so chiropractors were then working alongside orthopedic surgeons and neurosurgeons and the medicine. So it really helped the profession become more integrated in the healthcare team. And also in 1990 was the first time a chiropractic course was offered at a university of any type, and that was right here at Macquarie. So that was a very exciting year, and it was very revolutionary because chiropractic before then was always in private colleges. So that was the typical way of learning chiropractic. So, and since then, there are a number of programs have entered into universities, and many of them follow our model of the way we present it and the way we carry it through. And so here at Macquarie, and the majority of schools around the world have this rational approach to chiropractic, which involves research and evidence. And we want to have safe, reliable diagnostic procedures and effective and safe treatments. There are still within the profession those individuals who hold true to the tenets of D.D. Palmer, the original, but they tend to be fewer. But like many of the motivated individuals in small groups, they tend to make a lot of noise, and so they get a lot of attention. And so most schools, the vast majority, are more like this model that was put up by Haldeman. You can't see that, but Haldeman is a gentleman who has a DC, MD, and PhD, and he's very involved in the growth of the profession. And he's done a great deal of work for us. So in Australia, this is some of the research. I'm not going to go too much into it, but there was a research study that was done where it was sponsored by the association within Australia and the Macquarie University, where they did a bunch of surveys to see what people were thinking. And they surveyed chiropractors, they surveyed chiropractic patients, and they surveyed the general public. And I wanted to talk to you about what the patients were saying. These are the authors of the paper. And it was a survey, like I was saying, and they did a power analysis. They needed to have 384 responses, and they got over 100 extra to that. So that's saying that the responses were meaningful. 100 practices were involved, and they gave the questionnaire to 20 patients, sorry. So this is just some of the information, but you know, what I'm highlighting here is that yes, there seems to be a high percentage of female patients, but what that means is there are a lot of guys who aren't getting chiropractic care. And it's not like guys don't need chiropractic care, but it's perhaps the way we are communicating to the public. So there are only 4,000 registered chiropractors in Australia, and there's a lot of people that we're not actually getting access to or not accessing us. And so as everyone gets to know more about what the reality is of chiropractic and the benefit of it, it's surely to grow as far as how many people we see or seek our care. Most practices are in the cities. You know, chiropractors, they can practice anywhere, and they tend to go to where the population is and where it's pretty. So beaches and things like that, anywhere where it's nice to live and there's a lot of people, you'll find chiropractors. But everyone needs chiropractic care, and so there's lots of opportunity to go into the more rural areas. So I say this because people get concerned that there is a saturation of chiropractors. Well, my practice in California was in a small beach community, and it was about 12 blocks long, and on those 12 blocks were just as many chiropractors. And it was almost like what's that coffee shop, where Starbucks, where there's one on every corner. And but everyone was making a living, and as long as you have the public utilizing the care, everyone is making a good living and having a good life. So there's some information about the income and whatnot, but this is about the education and the occupation of the patients who are seeing the chiropractors. So a high percentage of them have university degrees. So it's people who are intelligent and who have been to school at least. Being school is an indication that you have been educated. It doesn't mean that you're not intelligent. So everyone here has the wisdom. And we can see that, that most people make their own choice when they want to go to a chiropractor. It's because of their personal philosophy. That's the deciding factor. So I was surprised to see how many people thought chiropractic was mainstream, and that's a very exciting thing for us because we are part of the healthcare team. Most patients come to us for neuromusculoskeletal conditions, and some might say that that isn't very exciting because neuromusculoskeletal isn't what keeps people alive. It's not like the life-saving procedures that medicine might do. But Erwin Kaur, who was a physiologist in Michigan working for the osteopathic college there, he said that the musculoskeletal system is the primary machinery of life. This is the part that allows you to express who you are. It's your self-expression. And that the organs were supporting the primary machine. So the organs were the support system for your self-expression. And I think that that rang very valuable to me because, you know, you do wonder, you know, did you make the right choice? Are you having the greatest impact? But when you have someone like, say, a bus driver who has a family to support and he's in a lot of pain and he comes to you and you help him get out of pain, help him get back to work and get back into supporting his family and feeling good about himself, that's a very rewarding situation. A young athlete might come to you who loves playing rugby and can't play it because of his knee injury. He comes to you, you work on him, he returns to the game that he loves and is very grateful. So also another thing about this primary machinery of life, you have a young mother, perhaps it's her first child, and during the pregnancy she developed low back pain, and that back pain is still going on, and she's struggling to lift her baby and do the care that she needs to do. She comes to you and you are able to help her so she can care for her child with less pain and more ability. These sort of things happen all the time, and these are the goals, the individual goals that you work with people. So, you know, people want decreased pain, but what they really want is the ability to do what they want to do. So it could be an elderly woman who loves walking her dog in the afternoon or whatever it is, and because of the hip pain, she's not able to do it, not able to take the path she prefers, and you're able to help restore that. So, being a neuromuscular skeletal specialist is really quite important, and we as chiropractors do that very well. And people come to us mostly from word of mouth. It's not through advertising, and that's a good thing. That's because we are effective at what we do, and patients are grateful. And patients were asked if they would go to, if your chiropractor wasn't available, would you seek another healthcare profession or another chiropractor? And they would choose another chiropractor, which is kind of comforting to know. So the thing about being a chiropractor is that, for me, is there's a lot of reward, a lot of satisfaction in what I do. And it's a really nice job where people you're able to help them and they're so grateful. You might not actually save their lives, but that's not what they say. They say that you saved my life. And that is a very exciting and satisfying experience. So here at Macquarie, you get 2 graduations. And I talked to you about the potential energy that I feel here at Open Day. I get to feel it also at the graduations, where they're on the precipice of another part of their life. And it's a very exciting aspect. And you get to have 2 graduations. You get the bachelor's after a 3-year degree, and you get another graduation after the master's, a 2-year degree. You can go into private practice, which is the majority of graduates. That private practice can take many faces. It could be by yourself, with a group, multidisciplinary, which is the future. That's the way things are going now. Academia with the research and teaching, and a lot of graduates go into corporate consulting and working with insurance companies and whatnot. So I would just like to close and to leave some time for questions with Dr. Wayne Jonas, from a medical doctor who was a director in the National Institute of Health in the United States. And he said that the chiropractic profession is assuming its valuable and appreciated role in the healthcare system in this country, he's talking about the US, and around the world. As this happens, the professional battles of the past will fade, and the patient at last will be the true winner. And that's really what we do. What we do is we help people, and it's the patients who are the benefit from our work. Thank you very much for your attention.